Hello friends, today I will be talking about an important clinical condition, that is hypothyroidism. I will be explaining to you what is actually hypothyroidism, the signs and symptoms, and a few tips that hypothyroidism patients must follow, right? So to begin with, thyroid hormones are extremely essential for our body to function well. The thyroid hormones regulate the basal metabolic rate, they regulate the heat in our body, they also regulate moods and balance our energies. So, generally, what happens in hypothyroidism, if I have to explain to you in simple language, hypothyroidism means underactive thyroid. That means the thyroid gland is not producing or releasing enough thyroid hormones or thyroxine that is necessary for proper functioning of the body. Okay. Now, the signs and symptoms that the patient may have who are suffering from hypothyroidism, one of the main symptoms is fatigue, extreme fatigue and tiredness. To do small tasks also, they have to push themselves. There is a kind of sluggishness in their body and they feel very lethargic and sleepy. Now, along with this tiredness, they may feel cold very easily. They are unable to take cold temperatures, or when the AC is, say, maybe on 18 degrees Celsius or 20 degrees Celsius, they are unable to take that, right? Even 22 degrees Celsius, they are unable to take the cold in comparison with others. A few other symptoms of hypothyroid patients are they suffer from constipation, they have puffiness of their face, there's a lot of puffiness on their face, also dry skin, and excessive hair fall again is a very common feature that we see in patients suffering from hypothyroidism. There is plenty of hair fall that is happening. There is a weight gain because the thyroid hormone is not produced in the right quantity. The basal metabolic rate also alters, and generally hypothyroidism patients tend to gain more weight. Also, very often, because of all these symptoms, and the patient feels very low, and negative thoughts and depressive thoughts affect them, right? So generally, if you think you are suffering from any of these symptoms, you must get yourself evaluated for thyroid levels, thyroid hormone levels. Or if you think a patient is visiting you and has these symptoms, please recommend these tests for them, right? It's a simple blood test wherein they check for T3, T4 and TSH. Now, TSH is the thyroid stimulating hormone. So if TSH is high and T4, that is thyroxine, is low, that means the patient is suffering from hypothyroidism. Currently, 5 out of 100 people are diagnosed with hypothyroidism. Women are more prone to hypothyroidism, but even men nowadays, we are seeing cases where they also suffer from hypothyroidism. So yes, one must get themselves evaluated for hypothyroidism. And now I will give you a few tips in terms of diet and nutrition, and some lifestyle measures that can help a person keep their thyroid hormones in check, and as in along with the medication that they are taking, these are the tips that they must follow. Now, one can opt for allopathic medication or even homeopathic medication. Homeopathy is also known to help cases of hypothyroidism, and we've had some wonderful cures with a triad of homeopathy, the right diet and exercise and counseling. Okay, so to begin with, in terms of diet and nutrition, what a person can do is, patients suffering from hypothyroidism, generally we tell them to avoid soy products. So any product that has soya or soy in it, they must avoid. Many people today, they have shifted to soya milk instead of the regular milk, but they must, patients suffering from hypothyroidism must avoid soya milk. They must avoid tofu, because that is again a preparation of soya, there is soy in it. They must also avoid products such as edamame, tempeh, miso. All these soya products should be avoided by patients suffering with hypothyroidism. The reason being that soya has a compound called as isoflavonoids, which interfere in the action of the thyroid hormone and the medicine as well. So definitely avoid all soya products. Along with avoiding soya products, they must also avoid cruciferous vegetables, because cruciferous vegetables are again goitrogenic and they must avoid it in the raw form. So avoid cabbage, cauliflower, broccoli, kale, turnip. Avoid these vegetables because these are also known to be goitrogenic, and avoid them in the raw form. If you really like them, have it cooked. Okay, and don't go overboard with it, have it once or twice a week. So these are a few tips in terms of diet and nutrition that a thyroid patient must follow. And one more diet tip for patients suffering from hypothyroidism: they must increase their intake of foods that are rich in zinc. That will help them. So they can have Brazil nuts and macadamia nuts, and there are many more sources of zinc, foods which are rich in zinc that they must consume on a regular basis, right? Now, along with these dietary tips, the patient must also exercise regularly. Exercise may not help in curing your hypothyroidism, but it will definitely help you manage the symptoms better, because hypothyroid patients are known to gain weight, right? So that is where exercise plays a major role, and exercise should be done regularly by hypothyroidism patients, whatever they like, whatever form of exercise. It could be jogging, running, swimming. If they like playing a sport, they can play badminton, squash for 40 minutes or 1 hour, whatever it is, but spend some time on your exercise as your regular routine and make it a part of your daily routine. Very, very important, so that you can manage all the symptoms better with whatever medication you are taking. Last but not the least, it is known that stress aggravates the symptoms of hypothyroidism. So they must try and keep their stress in control. One of the best ways to do that is to practice yoga and deep breathing and meditate regularly. So a combination of good diet and nutrition practices and exercise and yoga along with homeopathic medication can definitely help patients with hypothyroidism to heal better and in a natural way, right? So I'm Dr. Komal Gandhi, consulting homeopath, consulting nutritionist, and I will see you soon next week with another video on a health topic. Thank you.